When coronavirus disease 2019 hit the United States in January, most didn't know the magnitude of the emergency. Your union is working to make sure you have the resources you need for long-term planning. If you miss any part of this presentation, it's also available as a PDF. First, knowing what resources you already have is crucial. It helps to determine what you need in the future. Make a list of your food, medicine, and household goods. Keep a list of key contacts, including those at the state, provincial, and local levels. Organization is key by category, quantity, and expiration date. We have downloadable, fillable lists to help with this process at goiam.org. Click on the IAM's COVID Resource Center. Use what's in your fridge before it spoils and freeze what you can. Organize household items by noting quantities and length of prescriptions. If some items aren't available for purchase, you may need to think about buying ingredients to make substitutes. Organize your list of contacts like family, close friends, and trustworthy neighbors. Emergency professionals should be on this list, along with organizations that provide aid and utility companies. Think about places not open during regular business hours. Go to the websites listed at the bottom of this page for additional U.S. and Canadian resources. More than 2/3 of Americans have less than $1,000 in savings. That's nearly 70% of the country. And in Canada, 1/3 of the population only has 1 month of resources. You can't wait for an emergency to do a household budget. Start with your income. Identify all sources, no matter how small the amount. Then look at your expenses and include anything you routinely spend money on, even recreation and hobbies. Now you can categorize your expenses into needs and wants. Needs are expenses you can't live without and have penalties or consequences if you don't pay. Wants include expenses that can be reduced or eliminated. Remember, emergency situations call for drastic measures. You may have to make deep cuts, even to cable or entertainment subscriptions that keep us occupied while at home. You can add them back after the crisis. Eliminate unnecessary trips and ration fuel. Cancel non-essential club memberships and buy bulk if you can. Perhaps the hardest thing is to learn how to say no to yourself and your family, but hopefully all cuts will be temporary. It's possible you still won't have enough income to pay for your needs after you've eliminated everything you can. That's called a shortfall. Create a new financial snapshot minus future income loss by following these 3 steps. Sum up your new income, tally expenses based on the need versus want analysis, and subtract the new total expenses from the new total income. This is your adjusted projected shortfall. Here's an example of what a budget shortfall looks like. Even if the numbers don't look good, it's important to deal with a shortfall so you know how much your family will need and how you'll be able to meet that need. Identify possible resources that can help during a crisis. Make sure you have a list of these resources for reference, including unemployment benefits, government aid, or nonprofits like food pantries and shelters. Some creditors offer programs designed to help families during hard times. Remember to check out the COVID-19 links on our websites for more information, including a list of state and provincial resources. Union Plus is an excellent resource for discounts and other financial assistance. Signing up is free for any union member at unionplus.org. Credit card debt should be closely monitored during emergency situations. Many people rely on credit to help them through difficult times. Before you get behind, think about trying to refinance or look for lower interest rates. Make sure to pay at least the minimum payment. If you're already behind, contact your credit card company. Don't wait, because late penalty fees add up quickly. Some lenders are working with people during this crisis. If you're faced with job loss due to COVID-19, contact your bank or mortgage company to see if it has options available, like refinancing, loan modification, a repayment plan, or forbearance. Short sales and deeds in lieu of foreclosure are last resorts. Landlords and rental companies may also work with you. It's a good idea to make contact and let them know you're out of work due to COVID-19. Hopefully, the job loss is temporary. Communication is key. In these situations, landlords may be willing to accept partial payments until the crisis is over. Check to see if there's an order prohibiting utility or hydro companies from disconnecting your services. Remember, at some point, you will have to pay the bill, so try and conserve utilities whenever possible. In the meantime, contact the companies to request a payment plan or to ask about possible hardship programs. Your top priority should be food and medications. Think about what you're buying, both long-term and short-term. Buy food that can last, have a healthy household discussion, and plan your meals. Avoid emotional purchases. Remember to ask, can I afford this? And if I spend this money, will it cost me more later? Planned meals cut down on spoilage and waste. Use smaller plates to control portions. Cook simple meals. And think about how you will use leftovers. Can you freeze meals for later use? During an emergency, medical resources are extremely important. Plan for medical emergencies before they happen. Make a list of available resources. If you lost your medical insurance, emergency rooms are required by law to provide emergency treatment to anyone with or without insurance. Academic hospitals and dental offices often offer discounts if you ask. If you're going to lose your insurance, make sure to purchase the maximum amount of prescriptions before your insurance ends. Other options include the Consolidated Omnibus Budget Reconciliation Act, or COBRA. It's a short-term option. Sometimes, even if you don't fall under Medicaid income guidelines, children can still be covered through the Children's Health Insurance Program, or CHIP. Don't forget low-cost marketplace insurance available through the government. Many insurance companies and healthcare centers offer telehealth options as an economic solution and to enable physical distancing in cases where emergency care isn't necessary. Don't be afraid to think outside the box. Here are some other ways to save. Shut off lights in empty rooms. Turn off unused electronics. Don't let faucets run. Buy essentials that can be used for multiple purposes, and lower the temperature on your hot water heater. Wear warm clothing in the winter. Don't run the air conditioners much during summer months. Try to do things yourself that you would normally hire someone else to do, such as car repairs and yard work. Look for ways to use items you have on hand as substitutes. In the COVID-19 situation, we sometimes can't find the cleaning supplies even when we can afford them. Old shirts can be used as rags. Dish soap can clean more than dishes. You can use olive oil instead of shaving gel, furniture polish, or hair conditioner. Plus, shopping bags can double as garbage bags. You might consider selling unused items online, like unworn or gently used clothing. Use your mechanical, craft, or creative skills to generate income. Barter items or services. Borrow or rent equipment instead of buying, and start a small garden to grow your own food. This is a new situation for all of us. Don't panic and follow these guidelines. Information changes daily, so it's important to stay informed by watching, listening to, and reading from reputable sources. Don't wait to take action, and help others if possible. As our international president says, take care of yourself, your coworkers, your family, and your community. Together, in solidarity, we shall overcome. The word solidarity has never meant so much. For more information, contact the Community Services Department at Machinist Union Headquarters. Follow our social media pages and refer to the United States and Canadian Territories COVID-19 resource pages. Remember, you can download this presentation as a PDF at goiam.org.